The cervical vertebrae have kind of the most variation when you're looking at the vertebrae. So you're looking here, all of these are cervical vertebrae. There are 7 cervical vertebrae, but they do show a lot of variability. The first 2 vertebrae have special names, and then the other ones are just called cervical vertebrae, and they're numbered. But we're going to see when we look at this very first cervical vertebrae, it looks really, really different. You don't see much of a body on this vertebrae. It's really, you see that really large vertebral foramen here, and you can see the little transverse foramen on the side here. So you can kind of see those. I'm going to move this over here so we can kind of see that. So we see the vertebral foramen and then the 2 little transverse foramen there. You can see the superior articular process and facet right here, and you'll notice that they're these really big, like kind of almost like a bowl-like depression there. And so remember, this first cervical vertebrae is going to articulate with the skull. So if we take our skull here, and if we turn that over, and remember that you have that occipital condyle right here and right here, when we look at that, that occipital condyle is what is going to articulate in that superior articular process and facet. The way that that sits, it's going to allow for us to nod our head yes. So that's how you can see right here. It's going to sit right there like that. So that's going to be that superior articular process and facet right here. We also have an inferior articular process and facet right here, but you know, a lot of the other features, transverse foramen here, are kind of hard to see on this first cervical vertebrae. So this is the atlas. So A-T comes before AX, so atlas alphabetically comes before axis, which is going to be our second cervical vertebrae. So the second cervical vertebrae is the axis, so AX, so this is second. On this you can see some of those features we've been seeing before, so we can see the body here, we can see the vertebral foramen, the 2 transverse foramen. There's not a lot, but just a little bit of those transverse process here and here. We can see over here the spinous process is kind of reduced, but there's the spinous process, so you're seeing those. You see the superior articular process and facet here. If we kind of turn this down here, you can see the inferior articular process and facet here. So you can see all those features, but it has this one strange feature that we don't see on any of the other vertebrae. So you see this part that sticks up here. This is the dens or odontoid process. So you can call it either one, so odontoid process or dens. And what happens is it acts as an axis, so hence the name. When we take the atlas and set that on top of there, you can see that this allows for the rotation around that dens or odontoid process, and that's going to allow us to shake our head no. And we have a lot more range of motion right there in our neck because of the way that the axis and the atlas are shaped. So we can kind of see that there. So you can see those there. Then we're going to see these are further down. So these were our first 2 cervical vertebrae. This is the 3rd cervical vertebrae, and this one here is the 7th. So when we look at these, you can see some differences, but you'll also see some key features that are the same. So you can see the body on both of them is the same. You see that vertebral foramen. You can see the transverse foramen here and here. On this one, the transverse foramen. You can see the transverse process sticking out here, transverse process here. You can see the pedicle right here and right here. Same thing here. Pedicle right there. So you can see that. You can see the spinous process on these. So on the 3rd cervical vertebrae, it's still a little bit forked, so you can see that bifurcation or forking there. Whereas this one, the 7th cervical vertebrae, it looks much more in one piece, not forked or bifurcated, more like what you're seeing when you get to thoracic. So you can kind of see there. If we turn this around, we'll still be able to see the lamina here and here, lamina here and here on the cervical vertebrae. On both of these, the superior articular process and facet here. If we kind of turn these around, here inferior articular process and facet. On this one, inferior articular process and facet. And then right here, this piece that you're seeing here, and here is the pedicle. Same thing if we kind of look at these. Right here and right here is the pedicle. So you can see those features there. So hopefully you can see by looking at the different vertebrae, whether it's cervical, thoracic, or lumbar, they have many of the same features, but then there are a couple unique or distinct features when you look at the different vertebrae in those different groupings. This video is going to focus in on the thoracic vertebrae. So remember, the lumbar is the biggest, the cervical have 3 foramen, and then the kind of in-between size one that looks like a giraffe, that is going to be the thoracic vertebrae. There are 12 thoracic vertebrae in the vertebral column. Whoops. So we're going to look at this and we're going to see a lot of the features that we saw on the lumbar vertebrae and on the cervical vertebrae, you're going to see again on the thoracic. So if we look at the vertebrae here, you can see that body right here. So here's the body of the vertebrae. You see that hole right here, the vertebral foramen. The pieces that are sticking up right here and here that are flat, those are going to be the superior articular process and facet. Coming out towards the lateral sides, those are going to be the transverse process here. So those big pieces that stick out, transverse process. This part that sticks out here, very large and kind of points down, that's going to be the spinious process here. We can still see the lamina here and here, so that's going to be the lamina. Then as we kind of turn to the side, this other side here, we can see right here is the pedicle, right here kind of connecting the body to where the transverse process is there, so that's going to be the pedicle. We kind of angle this a little bit. We'll see kind of down in here is the inferior articular process and facet. So if the vertebrae sits like this, we'll see superior articular process and facet here, and the inferior articular process and facet right here. On the thoracic vertebrae, there's one special feature that you don't see on the other vertebrae. On the transverse process here, you'll see this kind of flattened, smooth area here, and then you see it again right here. That's going to be the costal facet. That's where the rib articulates with the thoracic vertebrae, and the ribs are only articulating with the thoracic vertebrae, and that's why you only see the costal facet on these thoracic vertebrae. So that's going to be the features on our thoracic vertebrae.